Hello everyone and welcome back. In this video I will discuss yet another question asked by my family. We all know that World Health Organization and other health authorities are actively promoting hand hygiene, which includes hand washing, hand sanitization, and less discussed but important aspect is hand behavior, hand etiquettes. Now the question is, does this really work to prevent the spread of viral infection like COVID-19? Do we really need to follow the hand hygiene, or is it just a general precaution which is being promoted? So watch this video till the end to learn the scientific reason behind this recommendation. In hand hygiene, worked to prevent respiratory and diarrheal illness in the past. And let's look at some of the evidence. Now, this paper was a meta-analysis, which means it combined all the published studies, and it showed that hand hygiene interventions reduces the diarrheal illness by about 1/3 and by a quarter respiratory illnesses. So that means the hand hygiene, it works, and it has been shown in different studies and all the studies combined together. So now the next question is, do we have evidence of whether it works in COVID-19? The answer is we don't know. But what's more impressive is that in the past there were coronavirus infection, including MERS, which was Middle East respiratory syndrome, and SARS infection, which was severe acute respiratory syndrome. So we do have evidence in coronaviruses in the past that the hand hygiene, it works, and the alcohol-based rubs, they are effective, and I will show you in a minute as to why the alcohol or the soap, it works against these viruses. So we have three options. So the one is practice hand etiquettes or cough etiquettes, where you either, if you get a sneeze or cough, you should sneeze or cough into bent elbow or into a tissue. Number two, hand washing. You can use water, you can use soap and water. Soap and water is more effective than plain water. Now it really doesn't matter whether it's warm water or a cold water. The third is the alcohol-based rub, and which means there has to be at least 60% alcohol content for this to be effective against viruses. So one of the important questions which I was asked was, which one should be really practiced? The short answer is we should practice all, because they help one or the other aspect, and they are really complementary to each other. Let's understand why. So if you see hand washing, it basically reduces the number of bugs on your hand. So that means the number of viruses, they get washed away. So the number reduces, and that's why the chances of you getting infection also reduces. Number two is the soap, it affects the outer layer of the virus, which has protein, and it kind of damages the protein, and these protein spikes are very essential for this virus to attach to human cells and cause infection. So once those proteins are inactive, the virus cannot really attack. So it's an avirulent virus. So it's there, but it is not able to infect. Second, the one of the layer is a fatty layer, which is again the outermost layer into which these spikes or these proteins are embedded. So the soap is able to damage this fatty layer, and thereby the outermost receptors gets damaged, and again the virus is no longer able to infect. So this is the reason why soap and water combined is more effective than just washing the hands with water, because that is just going to reduce the number of viruses, but it's not going to kill or make them ineffective. The same thing happens with the alcohol. So the alcohol, it works on the outermost layers and denatures the protein and damages the envelope, which has the fatty layer, and thereby it kills the bacteria or makes it avirulent. Another thing to remember is watch your hand. The behavior of the hand is very, very crucial. You're gonna touch many objects, you're gonna touch other people. So before touching, always ask yourself, is that necessary? And if you can prevent touching, you are basically reducing the chance of acquiring that virus to your hand. Now, most important is how to wash your hands. So this is the WHO recommendation, where you see there are 6 steps: 1, 2, 3, 4, 5, 6. And each of the steps is to ensure that all surfaces of your hands are washed, so that you are able to get rid of those viruses. Number 1, wet your hands with the water. Put enough soap so that it covers all the hand surfaces. Now, step number 1, palm to palm. So rub palm to palm. Then go to the back. Then go to the web spaces. Then is the back of the fingers. Then the thumb, and then tip of the fingers. So these are the 6 steps. Rinse your hand with water. Dry hands thoroughly with a single-use towel. Use towel to turn off faucet. And dry your hands. Now, the second aspect is hand hygiene using alcohol-based formulations. Very important. Most people, they just put a little bit of alcohol rub and just rub their palms. That's ineffective. So for the hand rub to be effective, it has to stay on your hands for about 20 to 30 seconds. So that means you have to put enough to rub your hand for another 20 seconds. And again, you basically do the same 6 steps, making sure that all the surfaces of the hand are covered. And then dry your hands. And once the alcohol rub is dried, that's when you get the maximum kill of the virus. So in summary, practice hand etiquettes, watch behavior of your hand, wash your hands regularly with soap and water for good enough time duration. So that means on an average 40 to 60 seconds, and use alcohol-based rub. And again, all these are complementary, because whatever residual bugs are there or viruses are there are gonna get killed by alcohol rub. So washing hand doesn't mean that you shouldn't use alcohol rub, but what you should avoid is going back, that is using the rub and then washing your hands, which is not suggested. So thank you for watching this video. Please hit the like button if you like this video, and subscribe